You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Larry Burk. He's an MD and a CEHP, a Certified Energy Health Practitioner. He uses what's called EFT, tapping, hypnosis, dream work, expressive writing, and Enneagram to coach you to heal physical illnesses. So we're going to talk about that and dreams and his work. So welcome, Larry. Thanks for coming.
Yeah, good to be here.
Good. Tell me a bit about your background. How did you get into this area of health and medicine that I guess people label as alternative?
Well, I'm a somewhat unusual breed. I'm a holistic radiologist, which most people think is an oxymoron. So I started out in the early days of magnetic resonance imaging back in the 1980s. And we were just doing pioneering work on MRI of the shoulder and MRI of the knee. And then I did that for the next 40 years and finally retired 3 years ago from Duke radiology faculty. And along the way, I discovered that many of my MRI patients were claustrophobic. And in order to get them in and out of the magnet, you had to either give them Valium or you had to teach them self-hypnosis.
You go in there and it's like, and it's right around your face and you can't move. And it's just like, it's terrible.
It's been described by a patient as a coffin that makes noise.
Yeah, exactly. Right.
So I learned hypnosis, which turned out to be a much better alternative than Valium. And it was actually empowering for people to have this experience of using their own resources to get through a stressful situation. Then they could use that skill later when they went to the dentist or whatever. We wound up training a lot of the MRI techs in how to teach basic hypnosis, which is simple questions like, where would you rather be than laying here in this magnet? I'd like to be at the beach or the mountains, and just go there and we'll tell you when to come back. And that's real basic hypnosis. Obviously, there's many, many layers of deeper hypnosis, but that was my entree into alternative medicine. Then I was on the National Safety Committee for MRI, and one of the things we were concerned about other than claustrophobia was the health effects of electromagnetic fields. And we were a bit ahead of our time then, because the only thing people were really concerned about back in the 80s was the health effects of power lines and radar. There were no cell phones.
Yeah, now cell phones with iPods in your head and all that. It's not good.
And strangely enough, I read a book called The Body Electric, Electromagnetism and the Foundation of Life by Robert Becker, who invented bioelectric bone healing. And I'm an orthopedic radiologist, so that was right up my alley. And in the middle of the book, he got given $1 million by the NIH to find out, how does acupuncture work? It must be electromagnetic. And he did some interesting research showing that the skin resistance actually changes at the site of the big acupuncture points, so that you can even use a little meter. It beeps when you go over the point and put your needle in there. And the caption in the book was, acupuncture has an objective basis in reality. So I learned acupuncture about 10 years later and was co-founder of the Duke Integrative Medicine Center back in 1998. And then about 4 years later, I discovered emotional freedom techniques, which is the tapping technique, where it's sort of an ideal combination between hypnosis and acupuncture, where you tap on the acupuncture points with your fingers instead of putting needles in them while you're focusing on a negative phrase, as opposed to hypnosis would be a positive phrase. And that essentially is like deleting a malware program out of your body. By tapping on the acupuncture points, you effectively uninstall a traumatic malware program that got downloaded into your nervous system perhaps years ago. And then you use hypnosis to install a new program. And it works really effectively and really quickly, and it's safe. And that was the basis for my coaching practice. And then I've been keeping a dream diary for about 40 years. And a couple of my friends told me they had dreams about breast cancer. I never really heard about that before, but they claimed the dreams happened before they had any x-ray studies or before they had a lump or any symptoms. Since I was a researcher, I wanted to find out more about this diagnostic technique. And I did a survey around the world and found 18 women around the world who had a similar experience, finding the breast cancer ahead of time before they had any symptoms or signs. So that prompted me to now have all my coaching clients keep a dream diary, because it gives you some amazing information about physical health and healing.
What do you mean? Like, what happens in a dream? How does it correlate with how you actually feel?
Yeah. I mean, well, the very first example was one of my close friends who had a dream one night that she was on the operating room table and a woman surgeon was operating on her left breast on a cancer. And she was 50 years old, hadn't had any problems, but she was so convinced that she went in to get a mammogram. And the radiologist came out and said, oh, your mammogram's fine. You can come back in 6 months. And she said, no, I can't leave. You have to do an ultrasound. And the radiologist kind of rolls her eyes and goes, oh, we don't just do ultrasound, on a fishing expedition. It has to be a lump, or you have to have, a mammogram that shows something suspicious. And she said, well, I'm not leaving the radiology department until you do the ultrasound. And so radiologist reluctantly gets the ultrasound probe out and said, well, I wouldn't even know where to look. She said, well, just look right here. She points to where it wasn't a dream. Radiologist puts it on the breast and is shocked to find a 1 centimeter cancer deep in the breast. That was pretty much of a freak show for that radiologist. And she said, how did you know it was there? And that's when she told her it was a dream, only after the fact. And then 2 weeks later, she went for her appointment for the surgeon, and she walked in and immediately recognized the woman from the dream. She had seen her a couple weeks before. So that led me down the rabbit hole into many layers of dream interpretation, which is quite fascinating.
Well, how many times have you seen that before, where someone's dream became reality later on?
I'd only heard it from a friend of mine, and it wasn't about breast cancer. She was a very prolific dreamer. Every morning she would get up and write down her dreams. And she had a dream about, it was about 5 or so years before I met her, of a spider crawling out of her mouth. And she interpreted that as having cancer in her mouth. So she went in, the surgeon did a biopsy of her tongue for a suspicious area and came back negative. What happens with people who are talented dreamers, if they don't get the answer they want the first time, then they ask again. And they actually intentionally write a question down in your dream diary and say, tell me more about that dream about the spider last night. I'm not sure I got enough information. And the next day, 2 characters from the TV show MASH show up, Hot Lips Houlihan and one of the surgeons. And they say, doctor, missed the biopsy, go back and have another biopsy. She goes back and has another biopsy. She has cancer. Goes through the surgeries. I met her 5 years later, and she had another dream that the spider was in a cage, escaped from the cage. And sure enough, cancer came back. And so people, once they make the initial diagnosis, sometimes they get advice about what to do about the situation in terms of healing or treatment from more dreams. So it's kind of a skill once you develop it that turns out to be quite useful.
Interesting. So what, again, does someone have to be having dreams and they tell you and then you say, all right, I can analyze them? Or do you ask them and maybe they're surprised and they say, I haven't thought about it, but now that you mentioned it, blah, 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 blah.
Yeah. And some of my coaching clients signs up to work with me. I'll just give them the prompt to start your dream diary, start asking a question every night that you want an answer to. It doesn't have to be about health. It could be about your job or your relationship or whatever is on your mind. And just assume that any dream you have is going to be related to that question. And people get some amazing insights into their situations. But it does require setting that intention to ask that question and expect an answer. And some people will tell me, I don't remember my dreams, haven't remembered my dreams in months. But once they start setting the attention, sometimes they'll get a little dream fragment, a word or an image, and then the next night they'll get a whole full-blown dream that explains everything to them. It's pretty amazing how it works.
Interesting. Are you able to tell the person, I don't know, tonight when you go to sleep, think about this, that, and the other, and I guess induce them to have a dream somehow with a suggestion?
Then pick the question, because it's really going to be the thing that's on their mind the most. It's like, and that's going to trigger the subconscious to generate the answer. So,
you can't guide the dream with suggestions?
I leave it up to them. I'll just say, you seem to be worried about your breast or your leg or whatever it is. You might want to ask a question about that tonight, and then just leave it up to them to do that. And then my job then is later when they bring the dream back to me is we use the International Association for the Study of Dreams protocol, which is you take the person's dream as if it were your own. You listen to the dream, and then you start with the phrase, if this were my dream, I'd wonder if that spider meant that there was a cancer crawling in your mouth. So you don't tell them what it means. You tell them what it means to you. And then the dreamer has the choice of either agreeing with how you feel about it or saying, nah, it doesn't feel right to me. I think it means this instead. And sometimes we do dream groups where you actually have like half a dozen people discussing someone's dream, and you'll get 6 different opinions, which is very valuable sometimes.
Well, why is it valuable? Just one of them happens to be right, or it gives a better perspective?
They're all right. They're just different dimensions of dreams can be interpreted in so many different ways. Someone will pick up one thing, and then someone else will notice another thing, and they're both could be true. My strangest experience like that was particularly regarding precognitive dreams, which are dreams that come true that you have, and you've written it down. You've got the evidence that you had this dream, and then a day later or a week later, the exact thing happens, and that, we call that a precognitive dream. Well, I had a series of dreams in 1996, about 3 or 4 dreams of specifically of tornado, and I was pretty blown away when every time I had a tornado dream the next day, there was a tornado in the news, particularly here in North Carolina. We don't rarely have tornadoes, and I would just check the newspaper the next day. Yep, there's a tornado in North Carolina. And even once I was in Florida on a business trip, I was flying home the next day, and the dream I had was there's a tornado hitting the airport in North Carolina. And my plane got rerouted the next day because the tornado tore the top off the hangar in the main.
Oh, wow.
And now I was pretty enamored with this whole being able to seemingly predicting the future thing. But 20 years later, I went to a conference on dream symbols, and someone mentioned tornadoes. And they said, when you have tornado dreams, it usually means your whole life is being turned upside down. And for some reason, it took me 20 years to remember that in 1996, my whole career got turned upside down. I went out of mainstream radiology into holistic medicine, integrated medicine, while I was having those tornado dreams. All I could obsess on was the fact that they would come true the next day. It never occurred to me that they meant something about my life. So they're 2 different meanings in the same dream.
Interesting. I guess like a deck of tarot cards, and I'm not saying this to demean it, but it's like, a deck of tarot cards would have meaning if you dealt it. These dreams appear to have correlative meaning. Remember that?
So, just discovered a new friend who's a retired sleep researcher from up in Canada named Carlisle Smith, and he wrote a book called Heads Up Dreaming. And I'd not heard of that when I wrote my book on dreams that can save your life back in 2018, but he's sort of been following a parallel path to me, except as a psychology grad student, he started keeping meticulous records of the dreams of everyone in his family and his graduate students. And he found out that a certain percentage of them absolutely would come true within a day, sometimes longer than that. But he said the ones that tend to have a tendency to be precognitive were short dreams of like one specific scene. And it wasn't one of these epic long dreams, a big saga. It was just these short ones. And he said it was amazing that you could sometimes get so good at this that you could actually be warned of a coming event like a car accident or some disaster and actually change the future. He said, I've not heard of it. Usually it's like,
what do you mean change the future? Because
what was going to happen?
So you're saying people take an action and then the dream didn't happen? Or was the dream like, this is going to happen no matter what?
And the car accident that they were going to be in was averted at the last minute.
Did that contradict the dream they had?
No. The dream said you're going to be a car accident. And right before the car accident happened, they remembered the dream and took a right turn and missed the accident.
Okay, so people are able to go counter to what the dream shows them. It's a software.
I'd never heard that before.
Yeah. I don't know if it was like a rule or anything. You couldn't, once the dream is, you're slated to happen, and that's it. But
yeah, I mean, most people say, "Oh, you're getting warned," but there's nothing you can do about it. It's like you're seeing the future. It's not like the future is changeable, but this guy seems to prove that it is. So.
Yeah, very interesting. So, all right. So, how often are you using this dream analysis in your practice now? All the time?
Every day with my clients. Yeah, and often it'll be when I'm doing the tapping technique. Again, we're looking for a malware program from the past to uninstall from the hard drive, and sometimes we're not sure which one's the top priority, and I'll ask them, well, did you have a dream about this? And once they share the dream, it's pretty obvious what the focus of the session needs to be, and that works pretty amazingly well.
Okay, interesting. What other modalities or things are you incorporating in your practice that are unusual?
I'd say I also use sometimes, there's actually, in my workshops that I do, I combine 4 or 5 different techniques in an attempt to see how many different things people can do in a short period of time. And these are also all scientifically evidence-based approaches. The first is meditation. I have them just do 5 minutes of meditation. And then, but I usually do a paradoxical meditation. If there's something they're concerned about, like a fear of something, I'll have them use a mantra as the opposite of that, which is I'm safe. So they're worried about fear. They're afraid of something, but I have them say I'm safe over and over again for 5 minutes. And what that does is that brings up all the things they're afraid of. It's like, you're pretending to deny that you're afraid by saying I'm safe, I'm safe, I'm safe. It just manages to dredge up all the stuff you're afraid of. And I tell them,
It does? What?
oh,
Why?
yeah, because they're saying I'm safe when they know they're not. And so they sit there saying I'm safe, and all the objections come up. Oh, no, I'm not safe. Hell no, it's a scary world out there. Oh, I've got all these fears. And so I tell them, just sit with that for 5 minutes, and then you're going to write them all down for 5 minutes. And then I just have them get out a sheet of paper, and it's called expressive writing. It's different than journaling. Journaling, you're keeping a dream journal. Like, you want to keep that forever, and you want to go back and reflect on it. Expressive writing, you get a single sheet of paper, you write for 5 minutes and try to fill like one side of a page. Use as many emotional words as you can about all your fears and all your things you're worried about. And then at the end of that 5 minutes, you stop and look back over what you've written and look for what's upsetting you the most. And then we use that as the focus for the EFT session, because that's what's bothering you the most. That's the program that's triggering you, and that's the one we want to deal with. And once you tap out that program, then the usual ritual is you destroy the paper that you've written. You either shred it or burn it, because the idea is you want to get that out of your body. And I didn't, until I took a course on this 10 years ago, I didn't realize there was over 100 research papers proving that this improves your health just by doing that.
That's crazy. Why do you think that is?
Because you're actually doing something to get those emotions out of your body. One of the problems with talk therapy, the way most people go to a psychologist or a therapist to do cognitive behavioral therapy,
Right.
That's proving not to be as effective as some of these other techniques that involve the body in some way. The tapping involves the body. There's some different somatic therapies, eye movement desensitization reprocessing, EMDR.
Well, it's like this physical animal movement, maybe lower brain activity, Maybe that's why it has such a powerful influence, because, that primitive part of our brain with phobias and things like that and fight or flight, it's incredibly powerful.
And actually, just the act of writing is a physical act. It gets it out of your body, out of your head. And one of the famous psychiatrists in this field, Bessel van der Kolk, wrote a pretty amazing book about 10 years ago called The Body
Keeps us.
Keeps the Score. You've heard of that. So yeah, that's like the Bible for this kind of work. And he basically says, if you can do all the talk therapy you want, but if your body still believes it, it doesn't matter.
So you're asking, so your body can't communicate to you with words, but this is a way that you can communicate with your body without it literally saying, talking to you?
Well, it's interesting. Jung and Freud, I'll talk about the subconscious as like some abstract thing out in your consciousness somewhere. I have come to believe that the subconscious actually lives in your body. These memories are stored in your body. And in order to really heal, you need to access the memories that are stored in your body and release them. And I actually have a fun play on words with the word emotion. In terms of the acupuncture meridians, there's the mysterious chi or energy flowing through your meridians. And if you break the word emotion up into 2 words and say E for energy in motion, emotions are supposed to flow through your body. And if they get stuck, that's when they get a symptom. And each symptom, any emotion you hold on to winds up creating a symptom at some point. And I treat those blocks like something that needs to be released, that needs to keep moving. And there's a wonderful poem by Rumi that we use a lot in the mindfulness programs called The Guest House. And it says, this being human is like a guest house. You never know who's coming to visit your house next. It could be a wonderful joy, a terrible sadness, a horrible thief. And he says, welcome them all in, because you don't know what they're preparing you for next. Perhaps the burglar is going to rob you blind and clean out your entire house, and some new joy is going to come in the next day. But the whole point is the title of the poem is called The Guest House. They can all come, but they can't stay.
Interesting. So How many sessions does it take? I know everyone's different, but on average, how many sessions does it take for a person to experience relief, and what does that look like for them?
It varies from person to person. Some of it depends on how much childhood trauma they've had. There's something called the Adverse Childhood Experiences Study from the CDC. It's probably the most important study ever done in medicine that most doctors don't know about. There's 17,000 Kaiser Permanente patients filled out 10-item questionnaire about abuse and neglect in childhood before the age of 18. And what they found was that predicted their likelihood to get chronic disease later in life. Their score, it was above 4, terrible things happened to them before they're 18, their life expectancy would go down by a decade. And it turned out to be the biggest risk factor for chronic disease ever discovered, beyond smoking, beyond drinking, how many adverse childhood experiences you have. So if you have someone who you encounter and you're working with who's had a lot, has a high ACE score, then you're going to have more work to do to get them healed. But if you have some person who had a happy childhood and has an ACE score of 0 or 1, and then they have a bad car accident, that might be something you need to clear out of their system. And that was actually the very first case I ever did with the EFT. Was I was teaching a stress management class for Duke undergraduates. Student came in after fall break and said, "Oh my gosh, I got hives all over my body, itchy, itchy, itchy." I go to student health. They gave me some Benadryl. It took the itching away, but now I'm too doped up to study. So I taken the Benadryl. All the hives came back. I don't know what I'm going to do. I said, "Well, I had just learned this technique the day before." I said, "Well, there's a new thing we can use." What exactly happened? Well, I had this scary car accident on the Jersey Turnpike and spun around in the rain, hit a telephone pole, airbag went off, wasn't injured, but I was really shook up, and I've had hives ever since. And I said, "Oh, well, maybe that's something stuck under your skin, your body's holding on to the fear." And I said, "Let's do this technique." And all I had was a 1-page cheat sheet. I was just reading the instruction. I said, "It says to make a phrase that captures your experience." She said, "Scary car accident." And it says, on a scale of 0 to 10, how bad was it? How bad is it right now? And it's called subjective units of distress. 10 is the worst ever in your life. 0, there's nothing at all. And it turned out that hers, she said, I was about a 6. But she looked more shook up than a 6. I said, add some more words to that to make it worse. And she said, "Oh, scary, thought I was going to die, car accident." I made an 8. So I said, "Okay, let's just follow the directions and you tap like 5 or 6 times on each of the points on your face and chest. And you repeat that phrase over and over again." And she did it on one side of the body and down the other side. It took 2 minutes, and her score went from an 8 to a 4. And I thought,
Nice.
this might be working. And then I looked at the sheet and it said, well, you can repeat the same process, or you can change up the phrase to a different aspect that might be worse. I said, "What's worse than almost dying in a car?" I said, "Is there something worse?" And she goes, "Oh, I totaled my dad's car." I was like, I said, "How high is that?" That was an 11. So she tapped on guilty about my dad's car, guilty about dad's car. And I went the whole way down to about 2. And she looked visibly relaxed. I said, "Here, take this sheet and just at home before next class is in 2 days. Just don't take any more medicine and just tap every time you feel the need to." She came back 2 days later. She was beaming. She goes, "No more medicine, no more hives." And I tap every time I feel a little itchy. And then she said, "And I tapped on all my other car accidents." I'm, what? I didn't know she had any other car accidents, but she figured out it worked for this one. Let's go back and handle all those other ones. Her inner healer kind of took over and told her what to do, because trauma tends to come in the theme through your life. In one bad car accident and you never regain your confidence in driving, what's going to happen? Well, you're going to attract another car accident until you go back and fix the first one. And that's what she did. And the same thing is true. You have an abusive father, you wind up having an abusive boyfriend, you might marry someone who's abusive, and keeps coming until you finally go back and heal the origin of that from your adverse childhood experience.
So how often have you seen tapping to be good, the EFT?
Well, in that case, what happened in that case, we call that a 1-minute wonder. Just did it once, it was gone. And I've had that happen a few other times. And I've had other people, I usually do like 4 sessions with boys, sort of a package. And then usually by the end of 4 sessions, they've managed to have some kind of worse.
Who are the hardest people to help and why that you've experienced?
Well, I mean, more women are willing to do this work than men, but I have to say the biggest breakthroughs have been in military veterans, because they're totally skeptical. When it works for them, man, does it work. Actually, when I opened my private practice finally in coaching, the very first client I had was a Vietnam medic, trauma in Vietnam from 40 years before. And his wife, who was a psychotherapist, referred him to me and said, he's got some anger issues that are unresolved, left over in the war. See what you can do. So he comes into my office and sits in the chair, and he's a businessman. He's on his second marriage. He holds down a job. He's not a homeless veteran. And I said, "What do you want to work on?" He goes, "I can't tell you." I'm like, "Okay." Fortunately, we have a technique, and it's called the movie tech. You just simply ask someone, if you had a whole collection of DVDs of movies, what would be the title of the worst movie you have? Oh, it's all over me. And of course, my immediate reaction was, I don't know if I want to see. But then you have him run the movie projector like one frame at a time. So it's on slow-mo and he goes at his own pace. And if anything gets distressing, he stops the projector and then does some tapping so his number doesn't go up too high, because, some of these people with bad PTSD, their number goes off the charts and they freak out, So we just gradually eased into it. He said, I'm in the foxhole with my best friends in Vietnam, and a mortar shell comes in, it basically explodes and blows his three buddies all over pieces. And he's the medic, and he's trying to save them all, and they all die. And he's been carrying that for 40 years, and we basically just started tapping on. Once he had said, okay, and now that you've got that movie and you've seen the movie, you can go through the movie again, and we'll tap our way through it again until your number goes way down, until you can talk through the whole thing and have your number not go up at all. And then at the end, I usually shift to a more positive, a hypnotic kind of suggestion. I said, okay, now that we've cleared all that out of your system, what are your favorite memories of those three guys? And he starts rattling off all their great qualities. He tears up. He's having an emotional experience. It's like the buddy, like he's back in a foxhole with these three guys. And his anger and grief is completely gone after a half an hour. It was amazing to watch.
That's really cool.
I was like, wow. And I was one of the first veterans I'd ever worked with. It was like, I didn't know what was going to happen. And having a beginner's mind is sometimes useful. But then I realized, wait, we still have half an hour left in the session. What else do you want to do? He goes, well, they took me off the front lines and sent me back to the base, to the morgue where I put the body parts back together in the backs. That was a real upgrade. And so we tapped on that and we finished the session. And I'm thinking, boy, I hope I didn't open some big can of worms. He said, check in with me in a week and come back for another appointment. It was just make sure you're healing. Comes back a week later and I go, how you doing? He goes, I said, do you have any Vietnam nightmares or flashbacks? And he goes, no, I think we handled the big ones. It's like, and it's true that if you get the really big ones, it knocks all the little ones over. You don't even need to deal with them. And so I'm thinking, okay, we got a whole session here. What do you want to work on now? He goes, my dad was a general in the Army. And I'm like, ooh, that'd be tough. So we tapped him. My dad was a general. My dad was a tough-ass general. We did that in half an hour. And I said, well, we still got a half an hour left. What do you want to tap on now? My boss is an asshole. The whole way from 40 years in the blue.
He's like, yeah, my therapist. Oh my God.
And so we finished that and he was done. He went back home. His wife emails him and said, what the hell did you do? He said, he's like a different guy, so it's crazy.
Oh, that's really cool. Does it work with, is there any age restriction? Like, have you ever done it with someone young, underage, like 8, 10 years old, 12 years old?
I mean, kids are kind of in a suggestible hypnotic state to begin with. So if you use the proper language, they're easy to work. And there's also something even easier for kids. Rather than tapping on their face and chest, we just cross your arms across your chest and tap on your upper arm with their opposite hands. That's called butterfly tap. And works great for kids. It's like a comforting motion. You're tapping on a lot of acupuncture meridians. And that's been done in disaster humanitarian relief efforts all over the world. And it's called butterfly tap.
Do you try it on yourself?
Oh, yeah. It's a self-care technique. You do it. I recommend doing it once a day on the worst thing that happened to you today. It's like, oh, let's tap that away so you don't wake up with it tomorrow morning. It's also a great way to get to sleep at night, because if your mind is ruminating on something, you just tap on it and say, my mind is racing. I'll never get to sleep.
Oh, I know. Yeah.
Wiped out tomorrow. And then at the end, you start shifting to, I'm letting that go. I'm falling asleep. I'm yawning. And then you go to sleep. So it's a pretty effective technique. When you ask who doesn't work with, I tend not to work with addicts, alcoholics, smoking. I mean, it has been used with those people, but you need special training in addiction therapy. You're going to work with someone.
Or why? What happens if you have someone who's like alcoholic tap? What happens to them? Maybe it goes back for opposite and the behavior becomes not that bad. Maybe it heightens their use.
They tend to have a lot of baggage with them. I mean, their adverse childhood experience scores tend to be quite high. And one of the reasons they're addicted is they're covering up all this trauma that they've been carrying since childhood. So they need a pretty comprehensive approach. I'm not looking for a quick fix on someone who's an addict.
What if you don't know what it is, but you try to think of it, but you don't know, and you do some tapping? Can it still work if you don't know what it is?
Well, my own example is I had chronic shoulder pain for 20 plus years on my left side during my first marriage, which finally started going away when I got divorced. And that was my aha moment of realizing that a lot of shoulder pain is related to repressed anger. It's just stuck in your shoulder, carrying that burden on your shoulder. And so my left shoulder doesn't hurt me anymore at all. And then I got right shoulder pain related to some political anger a couple decades ago. And that went away in a few months. And nowadays, when I get get shoulder pain, which is pretty rare. I mean, I do an insane number of pull-ups and push-ups every week and have no shoulder pain at all. But if I ever get shoulder pain, I'll assume I'm angry about something. And I'll start tapping on just my shoulder's really angry, my shoulder's really angry. I don't know what it's about. My shoulder's really angry. And sometimes just in that tapping process, something will come to the surface. So that's what I'm angry about. And then I'll release that and my shoulder feel better hours later.
How important is it if you bring up a memory, or you can't bring up a memory, but you identify where in your body the constriction or the problem is, and you tap on that versus just the tapping points?
I'll usually ask where people, it works the best if they have an event that they're working on, an emotion, and a place in their body where they feel it. Those are the three things that really make it the most effective. But sometimes you only have 2 out of 3 and you just have to work with God. The one thing I take home message for people really is that all symptoms should be treated as sacred messages from your soul. It's like, symptoms in Western medicine are just things to be suppressed no matter what the cost. Drugs that have side effects, surgery, procedures, whatever, just to make it go away. And I refer to that as the shooting the messenger approach. Whereas if you assume that every symptom you have is a sign that there's something in your life that's out of whack and you're off course, and the symptom's just attempting to redirect you and make a course correction, that way you wind up making friends with your symptoms, because now when I get shoulder pain, it just tells me I'm angry. And then I deal with it. So my shoulder's now my ally. So before, I was hating it for 20 years because I didn't know what it was about.
Yeah, that's amazing. Have you seen it not work on somebody? And if so, why?
I think some people just want a pill. I have a friend who is a cardiologist, worked with me in integrated medicine. And he said when people came into him for chest pain or whatever their heart problem was, he'd spend 10 minutes talking to them and he'd size them up and goes, "You just want a pill, don't you?" He said, "Yeah." They write a prescription and they're gone. Someone else would go, "You're really suffering from severe emotional heartbreak, aren't you?" And they go, "Yeah, you're right. No one's ever actually, acknowledged that." And he said, "Why don't you enroll in the mindfulness meditation course, do, some relaxation techniques, do some expressive writings, and you're really going through a major transformation in your life, and this symptom is triggering this." That's the 2 different paths.
Okay, maybe one more modality if there is one, but between dream analysis and EFT, it seems like you could help a lot of people. Is there a third modality that's very effective too?
Well, the thing that's really underutilized, I combine the EFT with hypnosis, but you got to realize that EFT, meditation, expressive writing, hypnosis all have literally hundreds of research papers on. And yet hypnosis is almost shunned in medicine, especially if you're in the Bible Belt like I am in North Carolina. It's like, oh, it's the devil's work, when it's really one of the most powerful techniques you can use. And I would have to say I use it for people going through surgery all the time, because it's been shown over and over again that the way you go into surgery tends to be the way you come out of it. So if you get yourself into a self-hypnotic state with all these positive suggestions about what you want when you come out the other side of surgery, when you wake up, it's going to start happening. If you go in fearful, and the worst thing you can do when you go to surgery is to pay attention when the surgeon's reading you the consent form. It's the worst thing in the world you can read before you go into surgery. It says, you could bleed, you could get infected, you die. And these are all horrible suggestions that you're going to the OR. And so if your surgeon's skillful, he'll say, well, you could bleed, but we're very careful to monitor your blood so that doesn't happen. You could get infected, but we're giving you antibiotics. That'll never a problem. And very rarely do people die. And so you
basically die, but everyone dies.
You negate all this. If in hypnosis, if you say, but after the first thing you say, it negates it. It's like, oh yeah, you could bleed, but that never happens. So it deletes that first phrase. So you really want the things you really want to go into surgery with are, think about what you want to feel like when you wake up. You want to be comfortable. And the real essential thing is you want to pee, you want to eat, and you want to poop. And if you go in thinking that as soon as I wake up, I'm going to have to pee, move my bowels, and I'm going to be hungry for my favorite food, you will do amazing.
Well, those are just kind of like neutral things, oh, I'm going to be hungry. I'm going to feel this. I'm going to do that.
Oh, most people wake up from surgery, they're nauseated and vomiting. But if you tell yourself you're going to wake up hungry for your favorite food, you will. And it gets even more sophisticated than that.
What about that with sleep? Was you going to get like 6 hours? You could say like, oh man, I'm only going to get 6 hours. I'm going to wake up feeling like shit. Or you could say, I had to get 6 good hours.
Some people get by on a very minimal amount. Some people need a lot. But for my hypnosis teacher, went through surgery, major surgery with no anesthesia. I wouldn't have believed it if I hadn't seen the video. But she had had an emergency C-section during the birth of one of her children. And she told the anesthesiologist, look, I'm very sensitive to anesthesia. Don't give me very much. And they ignored her, and she wound up in the ICU and almost died. So, and they had to stitch her up really quickly and left her with a big hernia in her abdomen that kept popping out all the time. And she needed to get it fixed. And she was terrified to go and have anesthesia and surgery. So she found a hypnotist and a hypnotherapist in Pittsburgh to train her how to do it herself. And then she had to shop around to find a surgeon who would operate on her with no anesthesia. And an anesthesiologist who would stick a needle in her arm and not give her anything. And so she does that. She gives herself the hypnotic suggestions when she walks in that she's going to become numb from the chest down to her knees. But the key thing she did was she said, and all the blood is going to leave my abdomen and go someplace else, so it's not wasted. And also she said, since I want to learn something, I want to feel the knife, but not any pain. So when she started the video, I thought, well, she showed this to medical students at Duke all the time, just blow their minds. And I thought she's going to be a deep trance, like she's going to be unconscious. Well, she's wide awake bullshitting with the anesthesiologist the whole time, while the surgeon has cut a 5-inch, wound in her abdomen. He didn't give her any Novocaine or nothing. And the surgeon said, are you sure you can do this for a whole hour? And she said, she did a Jedi mind trick. Oh, it won't take that long. And sure enough, because she had sent all the blood away, the surgeon didn't have to manage the blood at all. There was no bleeding for the whole half hour. And he said, afterwards, he goes, I didn't realize how much time I spent cauterizing blood vessels and mopping up the blood. I didn't have to do that this time. There's one drop of blood on the gauze pad at the end of a half-hour surgery. And halfway through the surgery, my friend Holly, my teacher, goes, there's something digging into my side, like hurts my ribs. Surgeon's going, what are you talking about? He's got his hands inside her abdomen. And he goes, no. And she goes, yeah, you checked. It's kind of bothering me. And so he goes, oh, I'm leaning on the metal retractor that's pulling her wound apart so he can work on it. And he readjusted the retractor, and he said, people don't usually complain about that, and then finished up the surgery, stitched her up. And she said, okay, he left the room. The scrub nurse was just there, and the scrub nurse in the room. The scrub nurse was starting to clean her up, take the drapes off and wipe the betadine off. And she gets a little bright. By this time, Holly has now turned the pain switch back on that she had turned off, and she turned the bleeding back on and everything else. So it would all heal the way it's supposed to. And she turned just enough pain on so that if there was a problem, she would know about it. So the nurse starts scrubbing around the incision. Holly lets out a blood curdling scream and goes, oh, what are you doing on it? And the nurse just freaked out. She said, what's going on? I said, oh, I turned the pain switch back on, and the nurses couldn't believe it. I was like, you just went through major surgery and now you're complaining about me scrubbing your wound. And it's just amazingly powerful when it works like that. No, Holly's the first. She's the first to say that most of her clients don't want to go through surgery wait. They just want to go in confident and come out and heal quicker.
Right. So where can other people dip their toe in and evaluate whether the dream therapy or the EFT or other modalities will help them?
I mean, they can check my website out, which is larryburk.com. BURK, or letmagichappen.com. That's the same website. And I've got lots of blogs. I've got 24 YouTube videos you can choose from, for preparing for cancer surgery, for losing weight, for dealing with different types of pain, sinusitis, all kinds of different things. So just on my YouTube videos, you go, and those are all free videos. And I've got lots of blogs, and I've got 2 TEDx talks that are on my homepage that I've posted. Yeah, so lots of, and they can subscribe to a monthly newsletter if I send out a newsletter once a month with some new hot topic and a new YouTube video. And if anyone wants individual coaching, I do 20-minute just intake free phone call just to see if it makes any sense for us to work together. And then after that, I do an 80-minute Zoom session. I want to record the tapping session so that they have that, use that.
Well, very good. Well, thanks for coming on the podcast. And it's really interesting, this stuff, So I encourage people to check it out. I know I will. And it's been a great call. Thank you.
Appreciate Mark Mead sending me your way. So, and I love the podcast you did with him.
Excellent.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.